insurance reform right now. Mayor, thank you for your leadership of our city on this and so many other issues, and David, thank you for yours. I know I can tell from a couple of quizzical looks out there, some of you are saying, you know, he just doesn't look the same as he does on television. and you're right, of course. Coming here to a church, it just seemed like it wasn't right to bring my red horns. Our health insurance reform legislation is about greater individual choice. It's about competition. It's about doing something about spiraling health insurance costs. It's about the number one cause in this country of personal bankruptcy, the number one cause in this country of credit card debt. It is about families who have good insurance coverage, who are not poor, who are working, who are providing well for themselves and consider themselves to be pretty well off. And yet, they've seen their premiums double since 2000. And they know that the co-pays rise and the coverage shrinks, and it's about folks like Jeff, because they could be, any family could be one pink slip, one healthcare crisis away from having no protection whatsoever. Jeff, what a compelling story you have to tell us. And more than anything you came to hear me say today, I think it is the individual stories that we will hear today from Jeff and others that are so meaningful. They're similar to the stories I've heard the last several years working as a member of the Health Subcommittee, and stories that I've tried to retell in our committee hearings and markups. Because we can talk about the numbers, we can get lost in the statistics, but this is about one human being facing a tragedy after another, all the way across this country. And for too many Americans, like the estimated 20,000 people who died in 2006 because they did not have health insurance, it is a matter of life and death. Certainly, this is an economic issue. But as Reverend Rigby and our church surroundings remind us, it's also a very moral one. How can people of faith do nothing when the American Cancer Society tells us that a woman diagnosed today in Texas with breast cancer who has no health insurance is 60% more likely to die than one who has health insurance? I believe that we're here today together because we want to right these wrongs in our society. For those we have heard today and hear on other occasions who yell, "Just say no," who say "no way," who say "never," who offer no solutions, I say what you tea baggers have to offer is mighty weak tea. So much of your passion is directed not at provisions in this bill with which we disagree on a policy ground. It's about provisions that are simply not in this bill, that don't exist in it. Doing nothing with so much suffering in a country as prosperous as ours is unconscionable. These disruptions, I can tell you, have not altered for 1 minute my commitment. They've only strengthened my resolve. But I've learned a lot from them. And I want you to reflect with me this afternoon a little bit and look at some of these arguments from a little different perspective and try to learn from what our opponents have had to say. As you know, I've been face to face with people who disagreed with me, up close, in town halls, in grocery stores, in call-in radio, recently at Teletown Hall, and I've tried to listen to what the fears are that these individuals are expressing because they're very real to them. And I think there's a great deal to be learned. They may be misguided in the leadership that has spurred them on, that just refuses to accept that a presidential election didn't go their way and that they can say anything and do anything to try to stop President Obama. And expressing so strongly their opposition, they've uncovered some truths that we need to appreciate. They talk of a takeover, of rationing access to health care. They talk of death panels denying necessary care to the elderly. They talk of a faceless bureaucrat obstructing a decision that should be between you and your doctor. I think these are real problems, not myths, but they're problems not with our new health insurance legislation. No, each of these misdirected claims actually describes something that's wrong with healthcare in America today. Rationing today, but it's rationing done by Aetna Insurance. There's a panel denying life-saving care, but it's at United Health. There's a bureaucrat in the way of you're getting good health care to the decisions between you and your doctor, and that bureaucrat's at Cigna. What opponents of our plan are really describing in their shouts on their signs outside today are not the dangers of reform, but the dangers of doing nothing about it. I pointed this out, but really we have the world's least efficient healthcare system. We have some great aspects about our health insurance system, about our healthcare system, but we have the least efficient system of anyone in the world when it comes to our dollars. We have actually a healthcare system in this country where more people are employed there concerned about denying care than actually being doctors and nurses and other healthcare professionals delivering care. Some of you have seen the retired insurance executive from Cigna, Wendell Potter, who's challenging his former employer. Very powerful. Takeover. It's a Wall Street takeover of health care. In the early 1990s, when the Clintons sought reform, health insurers took all the dollars that we collectively pay out in premiums around the country, and on the average, they spent 95 cents of each dollar to pay for health care claims. Last year, the same insurers, well, not the same because they keep consolidating and there are fewer of them, but the insurance industry paid out on the average of our dollars that we paid in a little over 80 cents of every dollar on health care. And last week, the Senate Finance Committee, with whom I have more than a few disagreements, began considering a proposal to tell them we're going to really ratchet down on them. They've got to pay out at least 65 cents. How do they continue cutting their so-called medical loss ratio number to wring out more profits of a sick system? And Jeff's given us a pretty good idea. They purge small employer accounts as soon as a small business has one employee that starts needing to use their health insurance because now they've got to do their chemotherapy treatment, so they've got a child that needs surgery. Are they engaged in a practice that is euphemistically called rescission? What that means is you're paying your insurance premium. You've been paying your insurance premium for years and have been playing by the rules, and finally you need your insurance. You need it a lot. So a department in these insurance companies start scanning all the medical records. And if they find that there was something you told your doctor that even though it didn't involve any fraud on your part, you forgot to put it on your application years ago, they rescind your coverage, cancel it. Thank you for being a policyholder. We're not covering you anymore. Over the 5-year period, 3 insurance companies have rescinded coverage just like that on 20,000 Americans, and they told Congress a month ago they're going to keep doing it for even more.